Beta's electric aircraft is a cross between a helicopter and an airplane. Leaders here say landing in the commercial sector is really helping the company take off. Meet Aaliyah. She often flies the Burlington and Plattsburgh skies multiple times a week. There's only 2 electric aircraft built right now. It's manned by 1 pilot, and for UPS's purposes, the cargo hold can contain up to 1,400 pounds of packages. 543. That's about how many families won't have a guaranteed safe place to lay their heads at night by this time next week, according to DCF records. They're telling me this news is devastating and sudden. Officials are now writing in a report quietly released earlier this week. Schools should take mitigation measures at a much higher level of PCB contamination than previously suggested. The parallels between the Petito case and the alleged murder of Emily Ferlazzo are clear. A 22-year-old woman goes missing after an argument with her partner while they're embarking on a vacation in a van. That rape happened more than 2 decades ago, but police say Yandau is still a potential danger to residents, especially adult women who would be his primary target if he was to recommit the crime. TJ Donovan, Secretary of State Jim Condos, and Treasurer Beth Pierce, they are all poised to hand the baton over to a new batch of Democrats. Customers tell me this Walmart is an integral part of the Northeast Kingdom's economy, but lately they've been disappointed when they walk through the doors. Some telling me they even have to check with neighbors, friends, family, even on social media to make sure the store will have what they're looking for. Thanks to this space, kids in this small town are taking their talents to new heights. They're learning the ropes on sports and activities they may have never had the opportunity to try before. It's been more than 2.5 years since the Burlington School District permanently shuttered these doors, wrapping the buildings in yellow caution tape and prominently posting chemical hazard signs. That fall of 2020, students were preparing to embark on their first pandemic-era academic year through a hybrid learning model. But they'd only spend 1 day in the North Avenue campus classrooms before their educational experience would forever become entangled in an unprecedented statewide problem. Burlington students sustained more harm than any other town or city in Vermont. That is the argument from families because of the school closure. What do you say to that? It is extremely quiet now, but earlier today, about 400 students filed into downtown BHS for their first day back to school. Teachers and students say this is going to be a new beginning for everyone in the Burlington School District after an extremely frustrating year. Still plenty of signs of the old department store. The escalator is the most obvious example. Students tell me it's going to take time to get used to the new space. The state is covering the cost for environmental consultants like Harper to test the indoor air in the estimated 325 schools. But that's it. Every effort after that is on the district's dime. The cost to investigate PCB sources and clean up contamination comes out of the taxpayer's pocket, and schools that exceed action levels can't opt out. If Carpenter is the illustrator drawing the line between 2 points, Carrie Hornbuckle is the academic who's been warning about the writing on the wall. Hornbuckle is the director of the University of Iowa's Superfund Research Program, which consists of engineers, toxicologists, PhD students, and public health experts, and they're all studying airborne PCBs. Together, Hornbuckle and Carpenter put the PCB picture into perspective. To some, a climb-resistant fence symbolizes psychiatric institutions of old, not facilities of the future. But the Department of Mental Health has demonstrated the dire need for a place to safely house and effectively treat a small cohort of Vermonters who can't receive adequate mental health care anywhere else. So by late spring, officials plan to open this state-owned and operated 16-bed recovery residence off Route 15 in Essex that all agree is a decade overdue. Police tell me it was a calm, clear evening just like this one when Tolman came barreling down this hill, hit Klassen, and then drove away. Health officials just told me that about 150 Vermonters got their first dose of the COVID-19 vaccine here today. Only one person didn't show up to their scheduled appointment. The Integrated Arts Academy in Burlington is one of 2 clinic locations in Chittenden County. The other is at Winooski's National Guard Armory. The idea there was people who live inside Burlington could walk here, while people who live outside the Queen City could drive in. Health officials tell me there were some kinks in the system they had to smooth out, but overall, patients tell me they were very pleased by the process. This sidewalk will be fencing, and within that, 30 pods that house between 35 and 40 people protected inside. Now, neighbors tell me they do support the project, but they would have appreciated the opportunity to weigh in before the city chose their front yard as the location. I'm just now learning more about what led up to today's situation after meeting with administrators about an hour ago. They tell me it was just one student making comments about bringing weapons into the school, and the needs of that child are being addressed. Now, everyone I talked to today all agree on one thing, and that's that parents, students, and staff do not feel safe in this district, and they haven't for months. Break out the cake and the candles because we are celebrating a big birthday today. You're gonna want to be all ears for this one. Right now, the decorations are up and people are pulling on those costumes for this Halloween. Parents are also getting ready to head out the door with their little ghosts and ghouls. So here's some ways to make sure the whole family's experience is spooktacular and not scary. The camera is going to represent mRNA. Inside is that genetic sequencing, this SD card, and it's attached to a lipid, which is the tripod. To change the vaccine, detach that mRNA from the lipid and reattach the new mRNA. Inside, genetic material that's effective against the variant. 543. That's about how many families won't have a guaranteed safe place to lay their heads at night by this time next week, according to DCF records. Now, dozens of the state's housing advocates and service providers have signed on to this letter asking the Scott administration to reconsider so those people don't end up struggling to survive outside.
It really mentally takes a toll on a person. You can't sleep good at night because you wonder, tomorrow are you going to get the call? You got to go.
For the past few months, Kathleen Marcia has called Berlin's Hilltop Inn home. She's terrified by next week she'll have the rug ripped out from under her, forced to seek shelter under Barry's bridges.
That's no place. We're not animals. Sorry. We'd be able to take what's on our back. Pretty much what would go on my walker.
Marcia suffers from severe back issues, among other health conditions, but she suspects the government won't grant an extension on her stay. A law passed in June gives eligible applicants up to 84 days of emergency housing. Only people with severe disabilities and families with children are eligible for an additional 30-day voucher. And next week, that 3-month clock will run out for about 550 families. That's 2/3 of the total households currently in hotels.
We'll see pregnant women, seniors, people with serious medical conditions that leave them really immunocompromised are going to be out on the streets and have no place to go.
Vermont Legal Aid staff attorney Jessica Radbourd, who penned the letter to DCF pleading for more time, argues the Act 74 rules are outdated.
The General Assistance Emergency Housing Program rules were negotiated in April 2021, and circumstances have changed dramatically since then. The pandemic is not over.
Friday, in front of the Joint Fiscal Committee, DCF Commissioner Sean Brown announced the state will hand out $2,500 cash to those exiting the program. While FEMA would supply 100% of the funds to house the homeless through the end of this year, Brown says money isn't the problem.
We simply do not have the motel capacity to extend households beyond the 84-day limitation.
Brown says soon leaf peepers will need those rooms. Legislators expressed deep concern, insisting vital housing for hundreds of Vermonters will sit empty until tourists fill them anyway. Many implored DCF to make a different plan. Still, Brown points to the state's historic multi-million-dollar investment towards shelter expansions under Act 74. But will those beds be available by next week?
Well, you know, with these funds, that's why we want to provide these funds so that people have the resources, you know, to either rent a room from family or friends or pay for permanent housing.
Today's state legislators say, frankly, affordable housing does not exist right now, so that's not a viable option for Vermont's homeless population. And the Queen City is likely to be under the greatest pressure because it has the greatest population. Shelter leaders say they're already at capacity, overwhelmed with the need, and that's only going to get worse next week. Here at a new place, the Champlain Inn in Burlington, dozens of people line up around this time every single night looking to snag a spot. And every single night, leaders tell me they're forced to turn between 5 and 10 people away. COTS on the other side of Burlington says it's seeing the same problems. Reporting live in Burlington, Christina Guessferd, Channel 3 News. They're telling me this news is devastating and sudden. Officials are now writing in a report quietly released earlier this week. Schools should take mitigation measures at a much higher level of PCB contamination than previously suggested. Now families in Burlington are convinced the district's decision to shut down and then totally reconstruct this campus would have been different had the recommendations been developed and presented to the public last fall.
Angry, disappointed, sad, confused. Seeing my daughter watch the news and tear up and say, "What, you mean they didn't have to close my school after all?"
Joanne Jordan's daughter spent her first 2 years of high school in Burlington, but she wasn't willing to spend her last 2 in a former Macy's. So she transferred to neighboring Colchester High School.
We're happy there, but we wouldn't be there if it was not for what happened here at Burlington High School.
Still, the situation isn't as simple as students and staff returning to BHS.
Wouldn't it be great if we could just go back to the same old, but you know, the reality of it is that there's been so much change in her life and in other kids' lives. It's just too much moving around.
This is probably the worst scandal in Vermont since JP. That's incredible that this has happened and 1,000 kids have suffered.
For more than a year, Dan Cunningham and a group of about 125 Burlington High School parents have condemned the health department's strict PCB guidance that ultimately influenced the district's decision to shut down the campus. Now families know the PCB contamination in most of the buildings is below the state's new school action level of 100 nanograms per cubic meter. For months, officials, including Health Commissioner Dr. Mark Levine and state toxicologist Sarah Vose, stood by the notion that even 15 nanograms per cubic meter is too dangerous. They now conclude it's common to find that amount of PCBs in any indoor air environment, which means most schools would exceed the recommendation and therefore require pricey fixes.
They held one school in the nation to a standard that they created. They introduced all of that anxiety, fear, disruption into people's lives effectively over nothing.
Superintendent Tom Flanagan and School Board Chair Claire Wool tell me they were also surprised to hear about the report because the state didn't give them a heads up it was coming out. They say they don't know yet how this information will impact the future of BHS.
We have a lot to digest, a lot to work with experts who understand this a lot better than I do.
We definitively need time. Potentially that process could have happened in those 2 months of our shutdown.
This is the document school leaders will be dissecting, which also details the calculation for those school action levels. Now, Cunningham suggests that the state should be held accountable for the situation Burlington is now in. He says many parents are suggesting that state toxicologist Sarah Vose and Trish Coppolina of the Department of Environmental Conservation resign. The health department tells me Dr. Mark Levine was not available for comment on that. For now, reporting live in Burlington, Christina Guessferd, Channel 3 News. Stabbing suspect William Dunn tells me his fiance's ex-boyfriend barged into their apartment here on Riverside Avenue unannounced and initiated a violent altercation. Well, that altercation ended with the intruder in the hospital in critical condition. Now Dunn says police got it wrong. He's the victim in this case, and he's hoping prosecutors will see the situation from his perspective. Here's what Dunn had to say about what happened.
This person came to where I was. I didn't come to you. You know what I'm saying? You came to my house. I didn't go to your house. You know what I'm saying? So why was I arrested?
Burlington police handcuffed 37-year-old William Dunn at these apartments on Riverside Avenue on December 2nd. He's accused of stabbing 27-year-old Najee McDowell at least 5 times. Dunn's charge, aggravated assault. His potential penalty, up to 15 years in prison.
Did you feel threatened?
Yes, I did. I had to fight for my life.
But when police arrived on scene, it was McDowell suffering from life-threatening wounds. And Dunn refused to answer their questions about what happened. So he was arrested.
Why didn't you immediately say to them?
Well, first of all, I was incoherent when they came.
Dunn says he was so traumatized by the situation, he couldn't speak. Later that night, Dunn told police what happened. Still, police upheld the charge.
He didn't say anything about self-defense.
Self-defense is ultimately a burden on the defendant to prove.
Dan Richardson is a private practice attorney and the former president of the Vermont Bar Association. He says Dunn's decision to keep quiet probably hurt his cause.
Police are not going to have some of the key pieces of information that they might otherwise use to make an assessment. To assert self-defense, you're basically asserting a justification for committing the act.
In other words, did Dunn have a right to repeatedly stab McDowell?
A lot of times what both prosecutors and defense attorneys will do is they'll parse down the moment. And they'll say, maybe the first stab was justified self-defense, but after that first stab, based on the medical evidence that we've received, there's no way this person could have responded, and the second, third, and fourth stabs were in fact not justified.
You've been arraigned. You pleaded not guilty. What are you hoping is going to happen next?
I'm hoping that these charges will go away and I continue to live my life productively and take care of my kids and move forward.
Chittenden County State's Attorney Sarah George tells me she's waiting for the police to hand over all the evidence from this case so her team can determine if they want to prosecute Dunn for aggravated assault or if they'll drop the case altogether and to that claim of self-defense. Police have not said if they're planning on charging McDowell for the intrusion, but UVM Medical Center does tell me McDowell is no longer a patient there, so he's been presumably released. Live in Burlington, Christina Guessferd, Channel 3 News. You see baby Lila now, and she looks like any happy, healthy 4-month-old infant.
Yeah, why don't you go play with the moose?
But just a week ago, Lila sounded like this. Mom, Alicia Sherman, and Dad, Seth Walker, say the week of Christmas, their older daughter, 20-month-old Ari, also born in a pandemic bubble, was exposed to COVID at daycare. Soon, the entire family tested positive for the virus. Even the vaccinated and boosted parents were suffering from symptoms. And by New Year's Eve, baby Lila was battling for her life.
She woke up with a 102 fever, and she was acting off. She wasn't as happy.
When was the moment you realized something's seriously wrong here? We need to go to the hospital.
I was holding her just like this and patting her back, and I could just tell she was just struggling to breathe. So I decided to bring her to the ED, and I'm really grateful I did.
That night, Seth stayed home with Ari while she slept.
I'm like, oh my God, like, is this the last time I'm gonna see her? Like, what is going on?
As the rest of the world rang in the new year, Lila was hooked up to an oxygenator. There, doctors told the parents they were baffled by the severity of the baby's respiratory distress.
I think that was one of the most heartbreaking moments. I started making desperate prayers to whatever higher powers are out there. And then I started making demands on those higher powers too. I was like, I'm not asking anymore, I'm telling.
What were you saying?
Keep my child alive, like get her through.
And while many were waking up to 2022, Alicia got the news Lila's levels were finally normal. Was there a moment when you felt like, I can breathe?
I guess I did have a little bit of relief, like, oh, yeah, it's getting better, but I still feel like I'm still holding my breath.
Every cough or gasp, you know, I probably lose like a few strands here or there, like whatever's left turns a little bit gray.
UVM Children's Hospital doctor Amelia Hopkins tells me the pediatric ICU has admitted a handful of infants and adolescents with COVID symptoms, and none have died. She wants to reassure parents the vast majority bounce back and stresses, rather than be alarmed, just be aware.
Tell me, what should parents be looking for in their kids for respiratory distress symptoms.
Retractions, which is when children are working so hard to breathe that they're using their belly and pulling in between their ribs. You can also be worried when you see flaring of the nostrils.
What do you want other parents with young kids to take from your story, to learn from your experience?
If you're worried, just go. Just go.
Trust your gut instinct.
Trust your instinct. I just don't want someone else to second guess themselves and have a worse outcome.
Hopkins agrees and says you can always call a physician if you think your child is in danger.
You know, what signs to look for.
In South Burlington, Christina Guessferd, Channel 3 News.